So do you think a lot of people can just live off of the PRP or?
Okay, so PRP is one of the adjuncts. When you
Mhm.
say can live off the PRP, I mean, the standard combination is minoxidil and finasteride. That's what the FDA has approved. Now, both finasteride and minoxidil, typically it's been minoxidil over the counter topical and finasteride oral. We flip that a lot because men are afraid of side effect with finasteride, even though it's a low percentage of temporary side effects. Nonetheless, I use a lot of topical finasteride. For patients that don't like putting stuff in their hair, we use a lot of oral minoxidil. So we kind of customize. We use a higher concentration compounded product. PRP is one of the adjunctive medical therapies. So we definitely use PRP. Low-level laser can be beneficial. Nutrition, adequate supplementation, adequate diet is important.